So is there such a thing as a no deductible health insurance plan? And is it affordable? Let's find out in this video. So everyone hates having a high deductible on their plan. And so let me go over what that is. A deductible is the amount that you have to pay after you pay your monthly premium, where after that amount, the insurance company will then kick in to cover whatever your services are, your medical needs are. So the deductible is the amount that you have to pay out first. So with no deductible plans, it kind of sounds too good to be true, but I have one of these myself. It's actually the way that I became a health insurance agent. So years ago, when I was leaving the practice of law and reinventing my career, I was looking for affordable health insurance. So before, I had the law firm, I did the whole thing. I actually went back and got a job. I sometimes leave that part of the story out because I feel like I sold out and went and got a job after I said I would never work for somebody, but I did. And I got this, it lasted like 8 weeks, but they gave me insurance. And so when I was trying to leave that horrible job, I really wanted to find something that was affordable, but that would still give me similar coverage. I wanted to go to the doctors that I wanted to go to. I was over having to be assigned to some HMO. So for me, I ended up stumbling across this company, and the insurance plan that I was quoted, it almost seemed too good to be true. So the best way to kind of explain how these work is just to tell you about my plan. And there's other plans that are similar to this. I've actually done very, very well with clients, and a lot of entrepreneurs really love these kinds of plans, or these similarly structured plans. So I'll go over that now. So my plan is bifurcated into two parts. Okay, so first of all, it uses the United Healthcare Network. So I have access to the United Healthcare Choice Plus Network, which is a huge nationwide network of doctors and hospitals. Everybody that I need is covered, more than covered. I will never run out of doctors to see on this plan. And if I want to look for a doctor, like if I need a doctor for something, what I do is I actually post on my Facebook, or I ask my friends for recommendations, and then I check the network, because 9 times out of 10, that doctor or that provider is in networks. And so that's a great place to be. The second thing is the plan structure. So the way the plan is structured is very, very innovative and interesting. It's actually bifurcated into two parts, okay? So I've got my base coverage, which is the front end of the plan, and that has no annual deductible, okay? So this company coined the term first dollar coverage, meaning that you do not have to meet a high deductible first before the insurance kicks in. You get coverage right away. Okay, so that base coverage takes up, I say, to my clients, think of like 95% of what you would ever use the plan for, all your day-to-day, sickness, accident, injuries, doctor visits, your preventative care, unlimited telemedicine. All of those things are first dollar coverage, no annual deductible, okay? So let's say something really big happened to me. Like, let's say I got diagnosed with cancer, or I had a heart attack, God forbid, or something really, really major. Let's just say even I got diagnosed with COVID and I was hospitalized for 2 weeks. Like unfortunately, some people had to undergo that. If that happened, I would have a lot of medical bills, probably in the hundreds of thousands of medical bills. So I would really need that unlimited coverage to the moon and back. So this is where the back end of my plan comes in, and that's the catastrophic coverage. My catastrophic coverage is actually separate. So I've got the base coverage, and then I've got the catastrophic coverage. The catastrophic coverage I don't have to pay for unless I need it. So I've had this plan for like 4 years. I've never needed, nothing big has ever happened to me, thank God. And so I haven't needed my catastrophic coverage, but it's there if I need it, and then it's available as an upgrade to my plan. So why overpay from day one if most likely I'm never gonna have anything major happen to me? But I wanna know that if something does happen to me, that I have that as an option. At that point, I'm willing to pay a little bit more to buy that policy, and it's no questions asked. And at that point, it's a $3,000 deductible, and they cover 100%. So I know that no matter what happens, I have no annual deductible on the base coverage, and if something major happens, my max out of pocket is $3,000. So I'm sure you're asking yourself, what is the cost of a plan like that? And would I be able to afford it? Well, if I had a comparable plan on the marketplace, I'd be paying almost double what I am paying right now. And so what I currently pay as a woman who I got the plan a few years ago, but I just turned 40. with all the bells and whistles, and I mean dental and vision and all of the good stuff. Very low out-of-pocket cost, lots of supplemental coverage built into my plan, and unlimited telemedicine. I pay between $300 and $400 a month for that plan. On the marketplace, having a PPO, it would be double that, especially if you add the dental and vision. And so I get to save money on my monthly premium while I'm healthy. I get rewarded for my healthy lifestyle. And God forbid something big ever happens, I know that I'm covered and I don't have to worry about, which doctors I can see and which doctors I can't. So if this sounds interesting to you and you want to see if you qualify for one of these plans, it takes 5 minutes for me to put a quote together. Reach out to me at alexandracondos.com. If you found this video helpful, please tag your friends who also might find it helpful, and please share and make sure to like and comment.